I'm Dr. Jordan Willis with Newman Regional Health Medical Partners, and I specialize in orthopedic surgery and sports medicine. I specialize in most areas of the body. My expertise is in sports medicine. I care for shoulders, hips, knees. I also do shoulder, hip, and knee replacements. I care for all ages as well, from pediatrics to the elderly. Orthopedics is my passion because it's simple. You see a broken bone or a joint that's not functioning and you get to create function with surgery or without surgery. You get to be the person who guides a patient through the process of recovering from an injury or returning a joint, an arthritic joint to health. Most important factor in patient care is being there, being present. And I think the fact that I live here in Emporia and am available to see all kinds of patients allows me to provide empathetic care to patients and the wide range of surgeries that I offer. And then also my partners in Lawrence allow me to care for a person entirely. Most of my training has been done in the state of Kansas. My training in Wichita, I saw a lot of trauma, high energy trauma from highway injuries and farm accidents. So I feel very competent in that area of orthopedics. And then my subspecialized training in Jackson, Mississippi and New Orleans allowed me to be a team physician and to know how to carry an athlete through injury to get them back on the field. I think what I can bring to Newman, what they haven't had in a while, is subspecialized training in sports medicine, but also newer technologies, newer proven technologies. I like the Mako robot for total knees, and just more cutting edge techniques for surgery as I continue to advance my training. Even after my formalized training is finished, I still go to all the national meetings around the country to hone my skills and improve every day. The most rewarding thing is similar to craftsmen. You do work and then you get to see your finished project functioning, and it's very rewarding to see that. I think first of all, those are my favorite patients to take care of. The farmer, the manual labor, because all they want to do is get back to work and they want to feel like they can work, and those are the patients that will recover well from any kind of surgery, because a lot of it is mental. They have the positivity mindset that will allow them to improve. But we have a lot of advances in orthopedics to care for the degenerative conditions, especially as our population ages. Hip fractures, I think, are in the top 3 most successful surgeries across all of medicine as far as patient-reported outcomes. Total knee replacements are becoming better and better as we improve our technology. And then obviously shoulder replacements as well is one of my favorite patients to care for, just because you get to see their recovery and improve pain and range of motion at times as well. As far as getting people back to work and back to what they love to do is my favorite part of being a doctor. A sports medicine emphasis allows us to take care of a wider age range of people, because we have the high school athletes, the middle school athletes that we are capable of taking care of, but then we also have the 50 and 60-year-old pickleball athletes that have similar injuries, different bodies, but similar injuries that we can take care of as well and get back to return to their sport. The availability for patients when it's convenient for them, and like a Saturday, they don't have school, they don't have to get out of school, the patient's parent doesn't have to miss work. They can come in, we can see them, we can at least get a working diagnosis to get some idea of what's going on with them. The size of the community is really advantageous for medical care, because we are big enough to where we have everything you need here to care for a patient. Even as a subspecialist like myself, I've got every imaging modality, every therapy that I can keep all of my patients locally right here. It's all in the same EMR for one thing, which is beneficial to me. And you have the ability to have relationships with all the people that you're sending your patients to. I get to go check on my patients who had an ACL in the training room at ESU or in the therapy department right across the hall from my clinic. Ease of practice and nice setup I really enjoy, and I think is beneficial to providers coming here.